Welcome to a special mini episode of Cancer Buzz. Lung Cancer Awareness Month is in full swing, and we're here to bring you tips on lung cancer screenings. The COVID-19 pandemic continues to significantly impact lung cancer screenings across the country, but we know targeted screenings and early detection are critical for optimizing lung cancer outcomes. Oncology nurse navigators are adapting their outreach, communication, and education to reach as many people as possible. Jennifer Aversano is an oncology nurse navigator at Advocate Lutheran General Hospital in Park Ridge, Illinois. Our community has talked a lot about screenings being impacted since the pandemic. How has COVID-19 impacted lung cancer screening?
So in the beginning of the pandemic here in Illinois, I'd say late March, April, and May, we did close our screening program for those months. What I was very surprised to see is that in June, we had the highest numbers that we've ever had when we reopened our program. So I was so happy to see that patients were coming back. And not only the patients that we had to reschedule were coming back, we saw, new patients starting to come in for lung screening with the importance of it. And that has continued over the last few months throughout the system, that we are still increasing our numbers.
Do you have a chance to speak with those folks that all came back in June? How were they being prompted to come back to a screening or initiate a screening?
We increased our virtual visits and the teletalks. I don't even know the amount, but I know that we surpassed our goal, what we had for this year. So I know that a lot of the patients were having virtual visits with their general practitioners, their primary cares, talking about being at high risk. We had, many patients scheduled in those months. And just to get them to come back, I had thought that patients coming to the hospital anyways, they weren't going to come to the hospital for things that they really needed to come for. And for screenings, I really was surprised to see patients seeing the importance of that, getting screened from their primary care recommendations.
How do you think the role of Navigator has changed during the pandemic?
I think that, us navigators, we're so used to meeting our patients in person, giving them the resource materials that they need, giving them a hug, giving them support in any way that we can. A lot of that isn't possible now. So navigation has really had to try to find how we can still do our role effectively during this pandemic. With many of us being sent home, having to work at home in the beginning, we didn't want to just let our patients go. They still need that support. They still need that education to come in for their treatments. And even though they might not be seeing us in person, we can't give them all the material sometimes that we'd like to give them. We can't give them a hug to help support them or, see our faces. We still are available to them. We still are trying to reach them in any way we can, whether that be through virtual visits, telephone calls, emails, however we can reach them to give them the support that they need during this time. We still want to be as available as possible.
Speak to your colleagues in the cancer care community. Any advice that you can offer them about lung cancer screenings right now?
Sure. So for lung cancer screening, there are only about, 4% of people that are eligible to be screened that are actually getting screened. So the education still needs to go out, and navigators are really a huge piece of that, getting that information out, not only just the primary cares, that you have large populations of patients that need to be screened. These are the questions that you need to be asking. There's a lot of EMRs right now, electronic health records, that are alerting physician primary cares when their patients are eligible to have a lung cancer screen. But it's got to be part of their health maintenance. They have their mammogram. Did they have their colonoscopy? Oh, they are at high risk for lung cancer. They need a lung cancer screen. It's just as important. So as navigators, we need to get that information out, not only to the primary care, but to the public about what it is. A lot of times patients call me and they say, my doctor wants me to come in for a lung scan. And when I sit down and I talk to them about the risks and benefits and the importance of having this lung cancer screen, they're like, okay, I'm going to do this. I'm going to do this annually. This is something that I really need to do so that you can keep an eye on me to make sure that I'm okay.
How can navigators get the word out to their communities?
I used to say we'd have community events or we'd have community lectures, or if we had, health fairs and that sort of thing, we would definitely do that. Right now, all of that is on hold. So how do we do it? And it's really just, right now, I think the main thing that we can focus on is getting that information out to the primary cares. Anywhere where there is any sort of virtual employee health talk or anything that we can get the faces of, lung cancer screening patients that have had them talk about how their diagnosis was diagnosed early and what their survival rate looks like now after having a lung cancer screening and having that lung cancer diagnosed at an early stage. I think having the patients tell their own stories to potential other patients is a huge thing that can help the community be aware. As healthcare providers, we can talk about the importance, but really have patients tell their stories can have a lot of impact on the community.
Head to the show notes for helpful resources on lung cancer screenings. Next time on Cancer Buzz, a look into CAR-T bispecific antibodies and the future of immunotherapy. For the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.